going to talk about cubital tunnel syndrome. So, if you have had if you've had tingling or pain in your inner forearm or in your fingers, and you're wondering if this could be a problem, a localized problem in the forearm, then yes, it is possible. There is something called the cubital tunnel syndrome, and this happens, you get these symptoms. So let's just discuss all this in detail because there are quite a few other things that can mimic or can present as forearm tingling or numbness. So before we jump into the topic for today, let me introduce myself to those of you who don't know me. My name is Swati. I'm an executive mom power coach. I help moms of younger kids who work in high stress executive jobs manage their physical aches and pains that come as part and parcel of your motherhood journey. Now, what I mean is simple aches and pains in your spine, in your joints, so neck pain, back pain, etc., poor posture that leads to these problems, and a lot more in there. Now, these could have started during your pregnancy, your childbirth, or in the later years as a mom. Now, usually when we are as moms, especially when we are working moms, we are busy, right? So most of us don't have a separate like 1, 2, 3 hours to dedicate to finding out why we have this pain and then managing it. It takes away quite a chunk of your very valuable time, or else you might be on the spectrum where despite being a busy working mom, you have everything under the sun and you haven't found the solution to manage these aches and pains. So this is where I come in and I help you with simple solutions and strategies, some lifestyle changes, etc., some simple stuff that you can implement or integrate into your everyday routine without having to take out a chunk of your time. And it just helps you better mom, less mom guilt, because you can be active with your kids without that pain gnawing away at you in the background, and you can be more productive at work. Now, anyway, moving on to our topic for today, can cubital tunnel syndrome cause tingling or pain in your forearm? Now, what happens is in our body, we have nerves coming out. There was like a bunch of nerves that exits the spine at your neck or your cervical spine area. One of them is known as the ulnar nerve. Now, the ulnar nerve is traveling down, and it comes, if you look at the forearm here, this is the pointy part of my elbow, and if you look on the inner side, there is a bony part here. This is where you get your golfer's elbow, right? So if you have suffered from that, like me, you would know it. It's not a pain you easily forget. Okay, so there is this soft area between these two bony points here. This is the part of the ulnar nerve. So what the ulnar nerve does is it sort of travels the two areas, and it supplies the outer part of your forearm, right? So this outer, this outer part of the forearm on here, not on the outer side, in this part here, and it goes into your little and your ring finger. So sometimes people confuse this condition. Okay, so let me just back up. So if you have any irritation or compression of the ulnar nerve in and around your elbow, and this area, which is known as the cubital tunnel, the area between the two bony points here on the elbows, this is the cubital tunnel. So if you have any any compression, any irritation, any pressure on the nerve in that area, this is known as a cubital tunnel syndrome. Basically, it's an irritation of your nerve, right? So what happens is then you get the symptoms down in this outer part here and in these two fingers, because these two fingers are supplied by your ulnar nerve. Now, sometimes people get confused with carpal tunnel syndrome. So because it's cubital tunnel and carpal tunnel. Now, the carpal tunnel syndrome is in your wrist area, and usually it's the other fingers that are affected, and these two little and ring finger is not affected in carpal tunnel syndrome. So this is how you would know which nerve is getting affected. In carpal tunnel, you have your median nerve. In cubital tunnel, it's your ulnar nerve. Anyway, you don't need to be bothered with these terms. It's just that in case you're confused, or you have somebody around you who hey, I have carpal tunnel syndrome, I had tingling in my hand, but yours might be different from theirs. So that's the only reason I'm addressing it here. Now, what will happen if you have a problem, compression or pressure or irritation of your ulnar nerve? Firstly, you'll have these symptoms. Now, what can these symptoms be? They can vary between either it can be constant or intermittent. You might feel pressure in this area. You might feel that nervy pulling sort of a pain, or it can just be a tingling, a numbness, or a tingling numbness. So there's a variety of symptoms you get. The reason for this is depending on which part of your ulnar nerve is being compressed or pinched, the fibers within the nerve carry different sensations. So suppose the fiber that carries the sensation of, say, numbness gets compressed, then you feel that numbness in the fingers. Right? So different nerves, nerve fibers within the same nerve will carry different sensations. So depending on which part of the nerve is irritated or compressed, you'll get those symptoms in your hand and forearm. Now, it's not necessary. You might have just the hand or just the forearm as well. So it can vary between people. What else? Yeah. So these symptoms of tingling, numbness, or pain in your forearm and or fingers will increase when you bend your elbow. The reason is when you bend your elbow, there's more pressure on this nerve. There's a more stretch. So imagine if you're like this and there is a nerve coming like this, right? So the nerve is coming down, from your shoulder in this area. Now, when you bend it, think about, okay, if I have my sleeve here, my sleeve is nice and relaxed, right? So the sleeve is nice and relaxed. But when I do this, my sleeve is tensed over my elbow. So similarly, your nerve is also tensed over the cubital tunnel. So if you are one of those who, say, are on your phone all the time, or for some reason you are, say, driving, or some reason you have flexed, as in bent your elbow for prolonged periods of time, that stretching itself can cause irritation or compression of your ulnar nerve. Or if you have arthritis, because of which you have bony spurs, that is uneven shape in the, like growths in the bone, that can cause irritation of the nerve. Or repetitive stress injury. So if I'm repeatedly bending my elbow for some, say, professional or sports reasons, then you can have cubital tunnel syndrome. Anything that leads to, say, swelling in the area, like fractures, dislocation. So there's like a variety of causes that can lead to cubital tunnel syndrome or ulnar nerve problems in your elbow area. Now, yeah, so this is what I wanted you to know about the cubital tunnel syndrome. So if you have tingling, numbness, or pain in the this part of your forearm, so not towards the thumb, but like coming down from the ring and little finger down towards your elbow, that could be because of a local problem within the ulnar nerve. Now, there can be other causes, like suppose you have cervical issues and you have a nerve entrapment or a nerve getting pinched in the neck, that can lead to these problems as well. But if your doctor has ruled out neck issues, you do not have any, say, golfer's elbow issue, then you probably want to think about the local compression of the ulnar nerve in your forearm and elbow. It is also possible, if you've had it for a long period of time, you can lose grip. So basically, you don't have so much strength in your grip. You'll be able to tell when, say, you grip with your other hand, your unaffected hand, and your affected hand. So you'll see a disparity there, or things might slip out of your hand unknowingly. You just go to carry, say, a glass of water and you can't carry it that well with the affected hand, or you might have pain coming up into your arm as well. So these are some of the things that will indicate that yes, you might be suffering from ulnar nerve problems. So you might have cubital tunnel syndrome. Alrighty, if you have any questions on this topic, feel free to comment below the video and I'll pick it up from there. And if you are looking for more tips and advice like this, or tips on how to manage these issues, you can join my free community. I will leave a link in the description of this video, and I'll see you guys next time.